Health Service Committee is one of the sectoral committee which draws its mandate from the Standing Order number 195-5 of Mandera County Assembly and the County Assembly Standing Order to perform the following functions. The mandate of the committees are to investigate, inquire, report on all matter relating to mandate, management, activity, administration, and operation, and estimate of the assigned department. B, to study the program and policy objective of the department and effectiveness of the implementation. C, to study, assess, analyze relative success of the department as measured by the result obtained as compared to their stated objective. D, to make reports and recommendations to the County Assembly as often as possible. The ownership of the project. We, the member of Health Service Committee, do adopt this report on the status of COVID in the county by appending our signature against our names. The names are Honorable Shaaban Hassan, Chairperson, Honorable Nur Abdinur, Vice Chair, Honorable Kul Aliyo, Member, Honorable Ali Nur Hassan, Member, Honorable Shamsa Ibrahim, Member, Honorable India Hussein, Member, Honorable Abbas Abdullah, Member, Honorable Farah, Member, Honorable Umul Khair Qasim, Member. Madam Speaker, the country, and majority of Kenyans have never experienced health pandemic like COVID in their lifetime. The pandemic has disrupted every life. It has posed great risk to our every sense of safety and well-being for most vulnerable people in our community, thus resulted stress in everyday living. WHO reported the first case of COVID-19 pandemic in the late 2019, and in Kenya the first COVID case was noted on 13th March 2020. The contagious disease first case in Mandera was confirmed on 5th April 2020, thus made Mandera County the third county to confirm COVID pandemic. As the case increased day by day, resulting to disruption of livelihood and increase in the cost of living in the county. Madam Speaker, Mandera County has overcome with all overwhelming health crisis due to porous border of Somalia, Ethiopia with weak healthcare system. The County Department of Health Service has amplified its effort for service delivery to the public. Number of health interventions were put in place such as 1. Screening at entry and exit point of the county to prevent the spread of pandemic. 2. Enforcing national ministry MOH guidelines such as wearing of mask, social distancing, provision of hand washing facility at market places and other social gathering places. 3. Intensified mass testing, public awareness through use of public address. 4. Contact tracing and training of health personnel in the county. 5. Procurement of PPE and other COVID-19 supplies, equipping and managing of health isolation centers. Key highlight of the COVID outbreak situation in the county. Madam Speaker, Mandera County has reported the first case of COVID pandemic. And it has impacted on mass screening of people within the county. Total number of persons tested since the beginning of the outbreak is 2,019, of which 854 were tested at Nairobi Molecular Lab, 224 tested at Mandera Molecular Lab. The total number of persons screened so far at 312,108, of which 314 are screened at Mandera County Health Facilities, and 98,794 people were screened at entry and exit point of the county. The total number of accumulated confirmed cases of COVID since the outbreak of the disease were 238 persons, out of which 34 persons succumbed to the virus, representing 9.8 mortality rate in the county. Out of 238 cases reported in the county, 235 are Kenyans, 3 were referred from Somalia. Madam Speaker, during the COVID outbreak, the Department of Health undertook enforcement of public measures such as hand washing, hygiene, social distancing, wearing of masks in public gathering in all sub-counties, and continue to enforce MOH guideline in the county. Additionally, Public Health Department has embarked on inspections and fumigation of schools be reopening and managed to inspect and fumigate 395 schools, both primary and secondary schools. Additionally, contaminated homes and offices were also fumigated. The table shows the status of COVID pandemic in the county between 7th April to 17th June as follows. Person tested for COVID 2,091. Positive cases 238. Number of contact traced 572. Number of screened patients so far 312,108. COVID death in the county so far stand at 34. COVID vaccination dose, which was started on 7th March, 3,177. These are those people who got first dose. Second dose, as at 28 May, 1,385. The number of isolation centers with staff and drugs and equipment are 3 in Mandera East. Number of home-based care was 10. Level of preparedness and number of bed oxygens and oxygen service in the county. Total number of beds in the county, Mandera County Isolation Center, which is the one which is opposite Riverside. It has 68 beds. Comor Infectious Hospital, which is at Comor, 68. Elwak Isolation Center, it has 86 beds. Health Workers Isolation Center, this is meant for staff and it is within the hospital. It has 20 beds. Other sub-counties, 64 beds. So we have a total of 308 beds, which is meant for COVID. Oxygen cylinders, the county has a total of 72 oxygen cylinders, and below is the distribution of oxygen cylinders in the hospital. Mandera County Referral Hospital, 40 cylinders. Mandera County Isolation Center, opposite Red Sea, 5. Ramu, 5. Elwak Hospital, 6. Banisa, 2. Takaba, 8. Lafe, 2. Kutulo, 2. Comor Infectious Hospital, the national government is installing oxygen manifold with 24 oxygen cylinders and 12 compressed air nitrogen cylinder. Madam Speaker, Mandera County has 3 oxygen production plants located at Mandera, one Mandera Referral Hospitals, one at Elwak Referral Hospitals, and one at COVID Isolation Center, respectively. However, according to the Health Department, the county is planning to procure and install 3 more new oxygen manufacturing plants at Takaba, Ramu, and Kutulo. Status of Comor Infectious Hospital. Comor Infectious Hospital was intended to host COVID-19 during active phase of this pandemic, after Mandera County COVID Isolation Center is full to the capacity. However, the caseload of COVID did not fill 68-bed capacity of isolation center. In this case, Comor was a standby facility in eventuality. In this case, Comor was a standby in eventuality the infection continues to soar. The hospital has equally 68 general beds for COVID patients. After the end of the pandemic, the hospital is to host other infectious and future epidemic and pandemic. The facility has a running water, electricity, waste disposal infrastructure, and ample space to offer health service with complete dispensary kit and ready for occupations. Madam Speaker, the Department of Health Service reviewed and analyzed epidemiological trend of first, second, and third wave and COVID infection centers, and they plan to open it to the public as to provide OPD and MCH to the residents of Comor in order to improve service delivery in the county. Uptake of COVID vaccines in the county. Madam Speaker, on 3rd March 2021, Kenya government received the first batch of Oxford AstraZeneca vaccine. A total of 1.2 million doses was received in the country. The vaccination exercise was launched on 5th March 2021, and countrywide vaccination began on the week of 8th March 2021. And 999,000 doses of vaccines was distributed to 9 regional depots, while the balance of 121 doses was retained at Kitengela Central Store. Madam Speaker, on March 2021, Mandera County received a total of 6,000 COVID vaccines of Oxford AstraZeneca from the national government. On 30th March 2021, the county launched the vaccination exercise at Mandera County River hospitals as a guideline provided by the National Ministry of Health. The vaccine was administered to front-line workers like health workers, security personnel, teachers, and elderly people above 58, and those individuals with underlying conditions. Madam Speaker, out of 6,000 vaccines received, out of 6,000 vaccine doses received in the county, total of 4,562 were utilized, where 3,177 were administered as a first dose, while 1,385 as a second dose, with balance of 1,439 was returned back to the national government. On 5th June 2021, 1,200 was retained, while 238 were returned on 3rd June 2021, 4 days before it expires, so that it can be utilized by other Kenyans before it expires. A total of male and female vaccinated so far were at 4,219 and 344 respectively, translating to 92% for male, 98% for female. Madam Speaker, that this table below summarizes first and second dose of vaccinations data in the county. Now, the number of health workers received the first dose, the number of health workers vaccinated was 468. First dose, 300, and those who are received the first dose are 327. Second dose, 137. Absorption rate of 10.2%. Security personnel, 2,002. First dose, 1,455. Second dose, 547, translating to 43.9%. TSC staff, the total number of staff who are vaccinated were 212. First dose, 163. Second dose, 49, translating to 4.7%. Those who are above 58, 1,201. First dose, 710. Second dose, 491, translating to 26.3. Total number vaccinated, 4,562. First dose, 3,177. Second dose, 1,385. From the statistics, it is evident that there is a below uptake of COVID vaccine in the county, and some of the reasons attributed to this are: one, misconception and myth and belief of the general public about the vaccine. Two, county government did not decentralize the vaccine to sub-counties, and the exercise was largely limited to Mandera Referral Hospital, thus inhibiting access. Three, lack of proper sensitization, awareness, education of the public on COVID-19 vaccines benefit. Four, fear that the vaccine causes infertility, health complications, and other safety concerns among the public. 5, social media propaganda that made many to shun the vaccine, that created unfounded beliefs and fears. 7, that it caused blood clots. It is beyond doubt that the vaccine has come at the time when the whole world is faced with unprecedented situations where many loved ones are lost. The essence of this vaccine is to prevent hospitalization, intensive care, admissions, and death due to COVID. Madam Speaker, the COVID vaccination uptake around the world have reasonably begun to realize it is pandemic. COVID vaccination rate uptake around the world have reasonably begun to realize that this pandemic will last longer than expected, and it is the issue surrounded with uncertainty that the only way to cap is working toward herd immunity, and this can be achieved through mass vaccinations or exposure to the disease. Herd immunity, Madam Speaker, herd immunity can occur when large portion of the community become immune to the disease. Disease spreading from one person to another is unlikely as a result of whole community become protected and just for those who are immune. Page 15, the challenges faced by the department during the period under review. One, high threat of potential spillover of COVID from Somalia through long stretch porous border, as several deaths and cases have already been reported from the neighbor town of Beledhau, neighboring Mandera town, and where there is no proper containment measures have been put in place. Two, inadequate number of untrained medical workers on the cases of case management, contact tracing, and general response activities. Three, inadequate logistic, i.e. transport for field, public enforcement, and contact tracing team in all sub-counties. Four, laxity on prevention measures among the general public. Five, high possibility of COVID transmissions and spread in the schools and poor home-based care protocols and compliance. Six, low uptake of vaccines. Committee's observations. Upon review, the deliberation of the status of COVID-19 situation in the county, the committee observed that, one, the Department of Health Service undertook proper mitigation measures during the outbreak of COVID pandemic by enforcing public health measures such as hand washing, hygiene, social distancing, wearing of masks in public, and other social gathering in all sub-counties, thus leading to reduction in the spread of COVID in the county. Two, there is adequate bed in all isolation centers and sub-county hospital during COVID-19 control and preventive measures, including 306 beds across the isolation centers, where Mandera is the isolation centers, the one which is opposite Riverside, has 68 beds, Comore Infectious Hospital, 68 beds, Elwak Isolation Center, 86, Health Workers Isolation Centers, 20 beds, while the remaining beds at the sub-county hospitals. Three, the county has 3 oxygen production plants, which are located at Mandera, Elwak, and COVID Isolation Center. 4, there are a total of 72 oxygen cylinders distributed across sub-county hospitals. 5, the County Department of Health is in the process of procuring and installing 3 more additional oxygen plants at Ramu, Kutulo, Takaba Hospital to enhance service delivery and reduce mortality in the county. 6, the national government is installing an oxygen manifold system with 24 oxygen cylinders and 12 compressed air nitrogen cylinders at Comore Infectious Hospital. 7, undertake COVID vaccine. The uptake of COVID vaccine is poor. Out of 6,000 vaccine doses received, a total of 4,562 were utilized. 1,438 was returned back to the national government before it expires. 8, there is a low uptake of vaccine by health workers, teachers, who are considered to be a role model that has affected the confidence of the general public in the vaccine, thus leading to vaccine hesitancy. However, 2,002 security personnel got vaccinated, representing 47% of the vaccine administered. 9, the total of 4,200 male and 343 male were vaccinated, which translates to 92% for male, 8% for female, respectively. Low vaccine uptake among the female gender of population. 10, the county did not allocate fund for COVID-19 pandemic in the financial year 2021. 11, the health department lacked critical centers such as mental health centers, which is crucial in such situation of pandemic. Recommendations. In view of the above observations, and the committee recommends the following. 1, Health Service Department should put in place proper sensitization awareness program to cushion the population against the threat of pandemic and potential spillover spread of COVID from Somalia through long stretch border, where no proper containment measures have been put in place. 2, budgetary allocations. Provision of budgetary allocation for Mandera Molecular Laboratory based at Mandera County Referral Hospital for purpose of equipment and reagent to enhance effective and efficient testing service in the county. 3, the department to continue training of staff on COVID and strengthen and to improve home-based care protocols and ensure full compliance of the same. 4, county to procure more oxygen cylinders and distribute to all sub-county hospitals. 5, the county department to empower village polytechnic to produce face mask for poor and vulnerable people in the community. 7, Mandera County COVID Isolation Center, formerly known as Rehabilitation Center, to be extension of Mandera County Referral Hospitals, and county to construct rehabilitation centers and mental units at Koromei area to care for the victim of drug and substance abuse and mental illness. The county government lies with IGAD and other international donors for establishment of fully fledged Kemri Research Center at Mandera County. The Health Service Department to train medical engineers and technicians for maintenance and servicing of oxygen plant. 10, the Health Service Department to purchase and install laundry machines in all COVID isolation centers in order to minimize contact with contaminated object linen to reduce risk of contaminations. 11, the department work toward herd immunity by vaccinating more people and overcome COVID vaccine hesitancy by putting effort in encouraging vaccinations and addressing how people think and feel about getting the vaccines. By using community leaders, religious leaders, local health workers as a role model in tackling vaccine-related fears and misinformations, and public health officials to sensitize the public on the benefit of getting vaccinated. Madam Speaker, I want to take this opportunity first to thank the Office of the Clerk for facilitating the community to come up with these reports. Second, I want to thank also the CC for Health, who was recently awarded the Galas Award as the best CC in the county. Mr. Speaker, since the pandemic, the county has done a lot. They have performed extremely well. There's a neighboring counties where there is who's and cry everyone now and then. Most of the staffs, and including recently, one of our colleague has passed away just because of lack of oxygen. But Mandera was adequately even prepared before this pandemic. During our first visit to the hospital, that is 2018, when the committee visited this hospital, that was our first visit, we identified 4 challenges or gaps. One was the oxygen. Initially, the county relied on cylinders being ferried from Nairobi. So the committee recommended that we should have an oxygen plant. By then, the acting chief officer was Al-Nur, who is also heading finance. That thing was put in the supplementary of 2018, and the county purchased 2 oxygen plants. That's why we never had crisis of oxygen in Mandera County. The other thing committee identified was there's a small generator in case of power outage. When the power goes off, it's only theater which is operational, but the rest of lab and everything. So we recommended that at least the department should source for a generator with high voltage. It was bought. They bought a generator with, I think, 500 voltage. So the power issue has also been sorted. The other critical part in that we noted on that visit was there was no adequate water to the hospitals. The hospital was infested with flies and cockroaches. So we recommended that at least the hospital should have a borehole, its own borehole. It was captured, and this hospital has a borehole, although it is now handed to Madawasko. So the issue of power, oxygen is no longer an issue. Madam Speaker, coming to this, on this pandemic, the only way out of this pandemic is through herd immunity. That's now the WHO has coiled path to herd immunity, path to normalcy. The only way to challenge these things, since there's no treatment for COVID, the only thing is now we should everything has to be geared to herd immunity. And herd immunity can only be achieved through two things: mass vaccinations or exposure to disease. When I said exposure to disease, back 1918, there was an outbreak of Spanish flu in the Western country. By then, this advent science or technology was not there. So what they did is they allow the disease to spread within the community so that those who dies, and those who contact and recover achieve herd immunity. But now we have alternative. Once you get vaccinated, the vaccine produce antigen. Once your body is triggered by these vaccines, it triggers the body to produce antibodies. So when you get infections, possibility of the disease becoming severe is less. So some of the benefits of these vaccines is that if a good proportion of these populations, Kenyans, are vaccinated, we'll ditch away with this mask and social distancing. We'll back to normalcy. From 1.5 meters, we can go back to 6 feet. So this 6 feet. So this is one of the advantages of COVID vaccines. At the same time, we can able to reconnect with our family members, because when there is a lockdown and you are not supposed to move, it will hinder our movements to visit even our ward or other part of the county. And at the same time, if you are vaccinated, there is a possibility that you get infection of COVID. In such situations, you are likely to have a severe disease. You just feel mild symptoms and it will subside away. As I have said, the county is in the process of procuring 3 additional oxygen plants to be installed at Kutulo, Ramu, and Takaba. I think the Kutulo one is already, I think it's being shipped from Turkey. But in the next 3 months, the one of Takaba and Ramu will be operational. So, Mr. Speaker, with those few remarks, Madam Speaker, with those few remarks, I urge the honorable members to adopt these reports, and I call upon Honorable Kula to second. Thank you.